Welcome to Aging on the Suncoast. I'm your host, Jason Martino. Well, we've had some time off due to the pandemic. We're back on the air now and ready to give Pinellas and Pasco residents good information highlighting senior resources and current events. A big thank you to the crew at Pinellas Communications for creating a virtual format to talk to our distinguished guests remotely. With that, it only seemed appropriate to have our first show back cover the still very present COVID-19 and its impact on seniors as well as those most vulnerable. We're lucky to have these two busy gentlemen today. We've invited the health officer, Dr. Yuli Cho from the Florida Department of Health in Pinellas County, and Mike Napier, the health officer with the Florida Department of Health in Pasco County. Together, we're going to cover COVID-19 as the issue remains, yet cover aspects for a healthier tomorrow. So Dr. Cho and Mike, welcome to Aging on the Suncoast. I'm very happy that you can make our show today.
Thanks for having us.
No problem.
Thank you for having me.
No problem. Dr. Cho, I'm gonna start with you, and your background is in infectious disease, and I just want to go back to the basics a little bit. Can you just tell us what COVID-19 is?
Oh, sure. Well, basically, I think we've all lived through this. COVID-19 has really been a once-in-a-lifetime pandemic, something that we haven't seen since the 1918-1919 Spanish influenza. COVID-19 is a respiratory disease caused by the virus SARS-CoV-2. It was first identified in Wuhan, China in 2019, and we all saw it as it spread throughout various countries and then throughout the world. And early on 2020, the World Health Organization did declare it as a global pandemic. Now, I don't want to underscore how big of an impact it had on all of us and society at large. Ultimately, what occurred is that it became the third most common cause of death in 2020. In the state of Florida, it increased all-cause mortality by about 16% when compared to the last 3 years.
Yeah, it's really unfortunate that those you had to even say those statistics there. Tell us, how is COVID spread?
So it's spread by person-to-person contact via droplets. When an infected person breathes out droplets and very small particles that contain the virus, it can be transferred to a person close by. And that's why I think early on in the pandemic, we were stressing that social distancing, the masks, just to prevent those droplets from infecting somebody else.
Yeah, and you know, the state of Florida, just like other states around the nation, they were tracking the infection rates. That was a big term that we all understood had to be tracked back in the day. Can you tell us a little bit about the statistics of the infection rates in Pinellas County?
Sure. Obviously, we watch the case counts and the percent positivity. That is the number of positive cases for a total number of tests conducted that day. So those are two of the bigger indicators that we watched on a regular basis. And throughout the course of this pandemic, we did see 3 spikes here in Pinellas County. And fortunately for us, recently, as of mid-April, our numbers have been downward trending, and largely due in part to those vaccine efforts. Now what we're seeing is a higher number of cases in the young, generally at 20 to 30 somethings, and now even the 10 to 19-year-olds. Unfortunately, there are pockets of our population that are more susceptible to severe complications, including hospitalization and death, and those groups include our aging population, those older than 65, and those with chronic comorbid or chronic health conditions.
Yeah. So you're joined by your counterpart in Pasco County today, Mike Napier. Dr. Cho just went over, you know, the basics of what COVID-19 was, the infection rates. What are the statistics telling you in Pasco County, our northern neighbor to Pinellas?
Sure, thanks, Jason. And you know, in general, Pasco and Pinellas numbers trend typically together. We too are seeing the 25 to 35-year-old age group that is the highest rates of infection right now. And that really shouldn't be a big surprise because we're also seeing that those are the people we're trying to get vaccinated, where the vaccine hesitancy seems to be the most prevalent, and that's our focus group. So we're following the same kind of numbers that Pinellas County is finding.
Yeah, and I know that you guys work pretty closely together because we have a population that's transient. Pasco residents, they come to Pinellas for resources, and and vice versa on that. Dr. Cho, I have some assumptions working with the senior population for so long, but why are seniors so vulnerable to COVID-19?
That's a good question, Jason. So unfortunately, the same holds true for a number of infectious diseases, whether it's influenza, whether it's bacterial pneumonias, among other things. Probably one of the most common reasons is due to just an intact or a robust immune system. When you're younger and healthy, you do have a more active immune system, so that is probably one of those factors. And that's why I think it's important that we encourage anyone just to maintain good health and just see a doctor on a regular basis.
Yeah, yep, and we offer different ways to provide access to those doctors. On your side of things and on the Area Agency on Aging side, it's something that we hold pretty important. So offering transportation and ways that people can conveniently get to doctor's office to stay on top of their health is super important. Mike, I wanted to go back to you, and I wasn't sure at the very beginning of COVID-19, and we're talking February, March of last year, of what the actual structure looked like on who really takes the lead on a national and on the state and at the local level in combating COVID-19.
Sure, and I think that to keep things in perspective, emergency events happen all over the United States. Blizzards, floods, tornadoes, earthquakes, and closer to home, and as we begin hurricane season, hurricanes happen all too frequently as well. But no matter where you live, your state and local agencies are involved in preparing and reacting to emergencies. Now, in COVID-19, it was a little bit different in that it was an emerging infectious disease, and it had an impact on the entire country. It wasn't isolated to a particular area. And that comes with CDC and the federal government, along with the state and local health departments, were the lead agencies. Guidance is provided at the federal level, and then individual states, as we saw, set policy that the local health departments work to implement with local partners. So it wasn't, COVID was a little bit different in the nature of what the emergency was. All your state, local, and federal partners were involved in the response. Yeah,
it's all hands on deck, really. And, during hurricane season, we've all lived by the credo that disasters are local, too. And so if I had an opportunity to invite a state representative or a national representative, I would much rather talk to you because you're living and breathing what these residents do every day. Mike, I'm going to stay with you on this one. During the course of COVID, mitigation efforts were imperative. They were so important. What did Pasco County do to mitigate COVID-19 the best they could?
Sure, and I wouldn't just isolate this to Pasco County. Our first initial efforts was isolation was our focus. We were focused on testing as many people as possible to determine the presence of the virus, and then if somebody was infected, making sure we were isolating those who may have been infected with a positive case. As we all know, we moved on to that from mitigation in our community. I think all of us are familiar with the social distancing, hand hygiene, and wearing face coverings. But lastly, really the most successful mitigation effort was the development of the vaccine and getting people vaccinated. Yeah. Now, there is still vaccine transmission in our communities, and we're finally making real progress in our trending numbers as far as the number of cases and number of positive people going forward. So all three of those mitigation efforts led to where we are today, where we're finally feeling like we are making headway on reducing and eliminating the COVID virus.
Yeah, and we're gonna devote a lot to today's show to talk about what you just said, the vaccinations. You also mentioned testing. Dr. Cho, is testing for COVID-19, is that still necessary?
Absolutely. As Mike mentioned, COVID is still around. It's still out in the community. There's still disease going on. It hasn't completely gone away. So it's important that you talk to your medical providers, or if you need to, consult your local health department. What we recommend and what the CDC recommends is that people who have those typical symptoms of COVID-19, including fever, chills, shortness of breath, sore throat, loss of taste and smell, among others, to get tested, because again, it is around, and especially important if you've been around and exposed to someone with a confirmed COVID-19. But again, I would encourage you to talk to your medical provider.
Sure, and I totally agree. Like a hurricane, we've been through our share of hurricanes in Pinellas and Pasco County and living in the state. Messaging, guidance, and information is extremely important. And I think we've all noticed that the messaging and the guidance and the information that came out since March of last year has changed and evolved. How come?
That's a good question. I think you have to keep in mind that COVID-19 was a novel virus, meaning it didn't exist prior to 2019. And for really anything else in science and medicine, whether it's chronic diseases, whether it's infectious diseases, we have decades of studies and research to really make those accurate sort of recommendations. So I think essentially what the community and society was seeing was science in action. I think we were learning new information each and every day, and there's still a lot we don't know about COVID. So as we learn more things about COVID, the recommendations also changed. I think the one thing that the scientific community could have done a little bit better was just get that messaging out that some of these recommendations aren't set in stone, that they are gonna, they had changed and they will continue to change.
No, those are good points, Dr. Cho. Mike, much like life, we learn from mistakes, we evolve, and we do things better. We create best practices. Is it safe to say that we've come a long way since COVID first came out, and we have lessons learned from this?
Sure. Like Dr. Cho had said, the novel virus was something that was new, and science needed to catch up. But the second part of the science is also communication. How did we communicate that information to the public in a way that they knew how to react to that information? One thing I did learn is that having an infectious disease doc as a friend and colleague in a neighboring county was priceless to me in our county. And I want to thank Dr. Cho for that many conversations. And so when we talk about lessons learned, it's about the network of how do we communicate and effectively manage a difficult situation.
Yeah, you're exactly right. And there's a great benefit that we have we share a border and we work together for a lot of different things. Hurricanes, when they come our way as well, they don't just stop in Pinellas County, they affect Pasco County as well. So back to what you're saying, it's all hands on deck. Dr. Cho and Mike, loved having you for our first segment of the show. You're going to be with us the second one, and we'll talk to you real soon. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center helpline, as well as information on COVID-19 from each county. When we come back, we'll take a deeper look at where do we go from here and explore the actions each county is taking to create a safe and healthy place for all.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Dr. Cho and Mike Napier helped us understand what COVID-19 is and the ways we as a community combated it. We still have some road to travel, so let's take a look at our county's next steps to promote safety and health. Dr. Cho and Mike, welcome back to Aging on the Suncoast. It was a pleasure talking to you during the first segment, and I hope our viewers learned a great deal, as I did as well. I said a little bit earlier that we were going to concentrate on vaccinations, because really that's where we are within this pandemic right now. So I was fortunate enough back in the H1N1 days, the avian flu days, to do a wealth of training with Pasco Emergency Management actually on pandemics. And one of the things that I remember from that really stuck with me is the pandemic comes, whatever virus it is, and there is a big push to combat that with with creating a virus. And then sometimes viruses mutate, and we work hard in the scientific community to try to make that virus just as potent to affect that. So Dr. Cho, can you elaborate a little bit on what it means to create a vaccination for something like COVID-19?
Sure. So when you look at any viral epidemic, outbreaks, pandemic, the development of vaccines is really the primary objective. It really is the most effective way to contain the outbreak and the pandemic and possibly eradicate the virus. Now, if you look at history, look at things like smallpox, it was eradicated purely by the efforts of a vaccine. And polio and measles have been largely contained in the United States due to this vaccine. So when you are looking at something novel like COVID-19, that vaccine development was always a top priority.
Yeah, and so now we're in 2021. We're faced with COVID-19. What kind of progress have we made in the development of the vaccine today?
Well, I think we've made a lot of progress, really through multinational cooperation, working with a lot of pharmaceutical companies, and with financial support through the U.S. government through Operation Warp Speed. They now have, in a matter of months, really developed 3 vaccines that did receive the EUA emergency use authorization in Pfizer, Moderna, and the Johnson & Johnson vaccine. Yeah. And to date, over 160 million Americans have received at least 1 dose. What they found, and the misinformation that's out there is that they skipped steps, and through the word Operation Warp Speed, it gives that impression that corners were skipped or it was rushed. But when in actuality that they did the same phases, they did the same number of participants in the studies as they would do for any drug or vaccine. And what all these studies have found is that for all 3 vaccines, they are safe and effective. In fact, when you look at how effective they were found to be 95% effective in some of these vaccines, which is better than the flu vaccine. It's better than the pertussis vaccine we have already out there.
Yeah, that's important to note that that the 95% infection rate was better than some of the vaccinations that we had before. But it seems like we learn and grow, and we do better, and we build off the knowledge that we had in the past. What I noticed in other states around the nation is that they had the ability to set up their own vaccination priority groups. And Florida, in my opinion, was a leader in many ways. And then they prioritized different groups. Can you elaborate a little bit on why Florida chose different groups for prioritization for vaccinations?
Okay. Absolutely, Jason. And as you sort of alluded to, each state did things a little slightly different when it comes to the priority groups. In the state of Florida, we followed more of an age-based approach, starting with those older than the age of 65, along with healthcare personnel and staff and residents working in a long-term care facility. And as we discussed in the first segment, that's where our vulnerable population is. That's where we've seen, unfortunately, the high death rates. In Pinellas County, for example, 87% of our deaths have come from those older than the age of 65. So it made a lot of sense to really start with the populations that were most impacted.
Yep. And I think we did all the right things when it came to prioritizing that. It's my personal opinion, obviously. Mike, vaccinations are saturating our community in Pinellas and Pasco County. They're available just about everywhere. Is everyone getting vaccinated in Pasco County?
Jason, I wish that was the case. Unfortunately, as I mentioned previously, our 25 to 35-year-old age groups, we're only at about 25%. And now that we've changed the eligibility to the 12 and older, we were anticipating a surge in that age group, and we're just not seeing that surge at this point. One thing that we are going to try to emphasize to parents with children to get vaccinated is that once children are vaccinated, fully vaccinated, they won't have to necessarily be excluded from school next year. So if you need a motivation to get vaccinated for your children, that would be a great one.
Yeah, sure would. Dr. Cho, what's it look like in Pinellas County? Is it the same, or is it different than what Mike indicated?
No, unfortunately, it's the same case in Pinellas and Pasco, and really throughout the state. I think early on we had a high demand, but as we increased eligibility, as we've gotten more of the vaccine supply, that demand has gone down. At this point, you can get the vaccine really anywhere, from medical clinics to pharmacies to DOH clinics. It's just people aren't showing up, unfortunately. And I think that's important if we want to get this pandemic really behind us, to get as many people vaccinated as we possibly can.
Yeah. And going back to older adults, you know, the Area Agency on Aging serving Pasco and Pinellas, we serve what we consider to be homebound individuals. And a lot of times homebound, especially those that are advanced in age, they lack computer proficiency. Many times they lack access to transportation to get them to shopping appointments and medical appointments. How has this impacted your efforts to vaccinate in Pasco County, Mike?
Yeah, Jason, and I'm glad you asked this question. Initially, we didn't have a good answer, and I will admit that. But I want to keep things in perspective. When we got our first 5,000 doses of vaccine in late December, and we offered it online in an appointment system, we had over 200,000 people attempting to get that 5,000 doses. It was chaotic, it was frustrating, and everyone knew we were missing this part of the population that you're mentioning. And when the demand was greater than the supply, we needed to be able to get the vaccine out as quickly as possible. As more vaccine became available, we worked with our partners like CARES and Hope Health agencies to be able to have them contact those homebound individuals and transportation challenged. Now we're working with your organization and have identified those who may need vaccines, whether it's home health going out to their location, or whether it's transportation picking them up and bring them into a pharmacy or a doctor's office. So while we didn't have a great answer at the time, I think now over time, anyone who wants the vaccine can get it now.
Yeah, well, you know, that just goes back to lessons learned and that we've learned and evolved from the whole process. And we appreciate our working relationship with you all. Dr. Cho, is it about the same in Pinellas County?
Yeah, I would say so. Pretty much, I think it all boils down to partnerships. So when we're trying to assess any of those barriers, such as computer proficiency, such as transportation, it's really working with community partners to address it. We work with libraries, we work with your agency. The state of Florida developed a homebound program. Just trying to reach those hard to reach people, I think, was one of the keys to trying to distribute the vaccine as effectively as possible.
Yeah, and I think what's important is that we all recognize that there were people that had limitations, and we met that head on, and we came up with initiatives to try to help them. So I hear the term a lot, vaccination hesitancy. Dr. Cho, what does that term mean to you, or terms?
So I think right now that's probably one of the biggest challenges with the COVID-19 vaccine. And in terms of vaccine hesitancy, it's not a new concept. It's something that public health has been battling even before the pandemic. And essentially what it means is not getting the vaccine due to concerns, lack of information, or mistrust. And what we've seen really throughout this pandemic is a lot of misinformation out there. So it's important, you know, where you're getting that information, whether it's a reliable source. Get your information through the CDC, the Department of Health, medical associations, etc. I would also encourage everyone to, for the right information, the correct information, to talk to medical providers, talk to your personal physician. Also, it's important to ask your friends and family. With more than 50% of our adults vaccinated in Pinellas, Pasco, and throughout the state, you obviously know somebody that's been vaccinated. Ask them about their decision-making process, their concerns, their experiences. Do they have any side effects? And really get their take to help inform your own decisions. In order to prevent any further outbreaks, you want to really get as much of that population vaccinated as possible. And vaccine hesitancy has certainly been an obstacle.
Yeah, I think one of the important things you said, Dr. Cho, is just to talk about it. I will put myself out there on a personal level. I have some friends that are hesitant, and in talking with them, I found out that they weren't as hesitant as what I had thought, and it turns out that they had actually gotten the vaccinations where I made an assumption that they did not. Mike, same terms. Does it mean anything different in your eyes in Pasco County?
Well, I think vaccine hesitancy is different in different age groups. When it comes to the COVID-19 and the hesitancy in our 65 plus population, there was less hesitancy because we knew the health impact on that age group. It was more severe, and so the hesitancy is less, and people wanted the protection that the vaccine offered. For those younger than 65, and specifically in the 20 to 35 age group, the numbers indicate there's greater hesitancy, and we need to do better with getting the trust, as Yuli referred to get people to get vaccinated.
So do you think, Mike, that trust is one of the biggest things that's necessary to encourage people to get vaccinations in Pasco?
Yeah, and trust comes in a lot of different ways, whether you are the scientific journal people who want to go to the science and CDC, or as Julie alluded to about, we're approaching 80% of our seniors being vaccinated in our county. We plan to leverage that fact. You know, those 65 and older are somebody's parents, grandparents, great-grandparents, and they've decided to make the decision to get vaccinated. We're going to be asking those that have been vaccinated at the 65 and older group to call their children, their grandchildren, and encourage that vaccination to happen, because I think that's where the trust in education will really be developed for the long term.
I think you're right. And let me tell you something, 80% vaccination rate in Pasco County is nothing to sneeze at. Seniors in Pasco County make up 1/3 of the population up there. And so that's pretty phenomenal in your efforts. Dr. Cho, anything to add on the Pinellas County side of things?
No, I completely agree with Mike. You have to keep in mind that our aging population is the most vulnerable, and if you're around and working with our populations, then it's even more important to get that vaccine. So continuing to push that message, continuing to push the right information, and continuing to encourage people to get vaccine, I think is important.
Yeah, thank you. Dr. Cho, testing sites are an ever-changing landscape, and as well as the vaccination sites. What's the status of the vaccination sites in Pinellas County today?
Sure, that's a good question. So I think we're at a point where we're somewhat shifting strategies due to that decrease in demand that we mentioned earlier, and the availability of vaccines in the private sector, including pharmacies and medical clinics. We're shifting it to where you normally get your vaccine. So if you get the flu shot, when you're looking for a flu shot, you get it at a pharmacy, medical clinic, and we're wanting to get to that point, and I think we are getting to that point where you can get the COVID vaccine in the same places. Yeah. We still have, in Pinellas, you can still receive your vaccine at our DOH clinic, so you can call for that appointment. You can get it from multiple pharmacies as well as various medical clinics. In addition, moving forward, we'll be holding special events for students as they go back to school for next year, as well as some smaller community outreach programs.
Yeah, and Mike, we're super short on time, but anything different in Pasco County?
No, I would just say that I'm very proud of the fact that we had over 130 locations in Pasco County that people could get vaccinated. So if there's a will, there's a way to get vaccinated in Pasco County. Yeah,
well, I'm personally appreciative of all the efforts that you do every day, not just during the pandemic. You are the leaders in health and creating nice, healthy systems and for individuals and communities. Mike and Dr. Cho, thank you so much for coming on Aging on the Suncoast, and we'll talk very soon.
Thank you.
Yep.
Thank you.
We hope you enjoyed this month's broadcast. We're so happy to be back and bringing you up-to-date information on a variety of topics to educate our community. COVID-19 affected our lives in really unfortunate ways, and we've learned a great deal thanks to our two guests, as well as the multitude of individuals working alone and together to stop the spread. I hope your days forward find you in good health and enjoying the new normal we are all faced with. Until the next time, stay safe, stay healthy, and stay tuned in.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.